What did you actually do then?
Went on roller coasters at Blackpool.
Wow. What?
Done everything, really. Carried on in my normal life.
During that period, you were unwell and on the chemotherapy or after?
Both, during.
Yeah. During and after?
Yeah, it wasn't going to get me.
No.
No way.
And what was the effect on your self-esteem of doing these things? Did you feel...
I forced myself, pushed myself.
Yeah.
And I thought, well, as I say, it's this strong medicine, but it's not going to keep me down. I should have done. I should have relaxed and rested a lot more.
Did the oncologist give you any cautions to say, oh, you're not allowed to do this or that?
Not really. He just said, just take it easy. But the mistake a lot of people, I think, do, they go on the internet and they look at the symptoms. Don't. Because it puts you into an awkward, kind of thing. And side effects. Yes. Now, I read about 150 side effects, so I was waiting for that one to happen.
Yeah.
So try not to look at what side effects it could cause, because you'd be very nervous.
Sometimes you can have too much information.
Yes.
About things that actually don't affect you personally, and then you can be watching out for them in an unhealthy way.
Yes.
It's possible.
Yeah.
You mentioned the internet there as a source of information, and I know it's not all good or all bad, but were there some things that were good out there? I mean,
brilliant, some, but when you're in that position, you just don't know if that's correct or not, because everybody's cancer is different. Yes. And they, say like I had tamoxifen, what was it called? Tamoxifen was what I had.
Yes, so one of the drugs.
And what was the name? Doxycycline. That was the name. Yeah, Doxycycline was the name of the actual chemotherapy I was having. Yes. And a friend of mine was saying, "Oh, I had that as well." Well, I had that, but her symptoms, she didn't get what I got.
No, she responded differently.
Exactly. So people, you cannot say, "Oh, she had this and that," because it doesn't mean you're going to. Each cancer's different.
Going back to my question about the internet and resources, though.
Yeah.
Did you ever use online support groups or go on to well-known websites to look up information that prove useful for you? Because not just information, you can actually sometimes get links to help groups or chat, online chat.
I didn't really find all that in 2000. Well, actually, I finished my treatment in 2008, but there's more out and available now.
It's increased a lot, hasn't it?
Yes.
Back then it wasn't so much.
No, it wasn't that easy, really.
So in that case, did you ever meet any other fellow patients going through it?
Oh, yes.
Who you maintained, kept in touch with?
Some I did, yes. I mean, we all met in the chemo suite because we all used to sit there for 6 hours all afternoon.
Absolutely. So you saw them regularly there?
Oh, yes.
And did you ever meet up outside of the hospital?
I used to keep in touch and ring them. Yeah. Yes.
Did you think that was a useful thing for you? Or not?
I think so. I think it makes you feel better if you can kind of talk about it, because the thing is, when you get home, you feel as if nobody else has obviously got it, only you. Yeah. And you're in a big bubble. You're looking out. Everybody rushing around on their everyday life, but you're not. You're stuck inside this bubble. Yeah. So when you do go to have your chemotherapy, we can all chat. I feel better today, or I've had to have this done today. So.
Did you ever think it was worth joining any support groups or anything organised?
I was thinking about it a while. I wrote a little journal of my own. Yes. That helped me.
Tell the viewers about the journal. What was that all about?
Well, it's for my own purpose in one way, because it's like, say, like you have a lot to remember, you jot things down, don't you? And you write, well, I do. I write the most important thing at the top and work my way down the list. Yeah. It's the same with this. I thought, well, if I can write everything down, it'll ease me a little bit and take a little bit of a way out of my mind of what I was thinking. So that's exactly what I did. I even wrote down because you can't take everything in, so I used to write each day down, the doctor said this today, this happened today, I feel a lot better now, and I used to write that all through every day, right up till the end of my treatment.
Did you ever used to look back at that?
I did. I can't believe I actually went through this journey, but it is a journey because I think it was 8 months.
Yeah.
So
you can understand why people call it the cancer journey
Yes.
rather than just the diagnosis.